And then now we have Meg Ryan to give us her study during the COVID pandemic on food insecurity, which was another major topic throughout the pandemic.
Thank you so much, Dr. Chen. That was a really wonderful presentation, and I see the overlaps kind of between some of what you found and some of what I found as well.
Meg, if you could possibly just speak up just a little bit. Meg, we can't hear you. Okay.
Can you hear me better now?
A little better, yes.
Okay, so should we raise it a little bit higher?
Yes.
Can you raise it a little bit higher? Can you hear me?
Yes.
Perfect. Okay. So as I was just saying before, I was just thanking Dr. Chen for her presentation, and I said that there was some overlap between kind of what she's saying and what I'm saying. And I took a picture of a couple slides that I'll comment on later as part of the overlap. So I'm presenting about food insecurity and mental health disparities among women during the COVID-19 pandemic in the US-based urban cohort. So I just wanna, this is left over from another presentation that I did, but I do have nothing to disclose. Okay, so the COVID-19 pandemic, as Dr. Chen was just saying, was a mass stressor that hit the New York region. So Dr. Chen kind of took us through already the history of the pandemic, but in New York, in particular New York City, which is where I work and operate out of, the pandemic really started in March of 2020. So in March of 2020, we at the Psychiatric Institute where I work in New York City, we were told that we were going to be shutting down, that we were going to have to move all the work that we were doing for years. So we were doing many years of research in individuals' homes. So we were interviewing them face to face about traumatic experiences related to several different topics, including 9/11 exposure, criminal justice exposure. And that was a huge part of what we did, is doing this face-to-face work. So in March of 2020, we had to transition to be virtual. And Dr. Hoven, who is the principal investigator of this study, in her wisdom and in the principal investigator of the studies that we had previously, saw an opportunity to understand on a ground level how people were being impacted by COVID-19. Because we were in the height of the pandemic in March of 2020. We were locked down, we couldn't leave our homes, the death rate was skyrocketing, as you just saw from Dr. Chen's presentation. So it was a very difficult time. So this is looking at the waves of our study. So we have wave 1, wave 2, and wave 3, and the time periods of when they happened. So the wave 1 part of our study was kind of at the height of the COVID pandemic. So from March of 2020 to August of 2020. Then we had another study, wave 2, or another interview that we did from September to about February. And there was a lull at that period and then a bit of a spike, but it wasn't the huge spike which happened, as Dr. Chen said, in December of 2021. And then from March to August of 2021 is our third wave. So we unfortunately missed that second big hit of COVID that happened during the Omicron pandemic in New York City. So if you're interested about that, there's tons of stuff published about that. It was a very stressful time to live through, but at that point, many people were vaccinated. So it was different than it was at the beginning of the pandemic, when there was still a lot of uncertainty and a very high rate of death. And it was a very different time. Sorry, I'm having a little bit of difficulty with the slide. Okay, thank you. Thank you to UG Help for helping with the technological issues. So this is kind of a breakdown of what the study was like. So we had 3 samples that at the time of March 2020, we were working with doing face-to-face interviews. So these face-to-face interviews were about stressful experiences that happened to them and the effect of those stressful experiences on their mental health. So we had 3 samples that we were working with at the time. So there was a population of parents that had been somehow involved in the criminal justice system, mostly within the South Bronx. So they were arrested or incarcerated at some point in the lifetime of their child. We also had 2 populations of 9/11 exposed youth. Some were directly exposed to the attacks of 9/11 by living or working in the area below Canal Street on 9/11, or I'm sorry, living or attending school below the area below Canal Street on 9/11. And then we also had a population who were exposed through their parents' exposure. So it was an indirect exposure. So these are the 3 subpopulations, and together we put them into the COVID check-in study. So we were checking in with our participants about how they were doing during COVID-19. So we had 3 different populations. The tying theme of all the populations are that they are youth exposed to trauma. So youth exposed to trauma that we were following up with because they were being exposed to another trauma, a mass trauma that was affecting all of them, which was the COVID-19 pandemic. So this is kind of the basis for our study and the research that I'm going to be speaking about today, is this COVID check-in study and the 3 longitudinal waves, which I just showed you before. So those are the 3 longitudinal waves, and this is the sample. So in our sample, we included exposed and unexposed groups. So for every exposed youth, we had an unexposed youth. That was our control sample match. So it is a little bit more complex than trauma-exposed youth because we do have control cases as well that didn't have that exposure, but were living in the area, the same area as the exposed youth. We also included parents. So there were parent participants for all of these studies that participated previously. Oops, sorry, now I keep going backwards. Okay, so now I'm going to talk about what was happening in New York City during the pandemic and why it was important for us to do this type of research. So during the pandemic in New York City and New York State, and basically all across the US, unemployment was very high. This is particularly true for workers in bars, restaurants, and retail. And a lot of those industries are dominated by female employees. So that's kind of a component of what I'm going to be talking about today, is how gender plays a role in this relationship between food insecurity and mental health. There were also a lack of childcare options. Daycares and schools were shut down, and the majority of the care fell mostly upon women. There was also an increased demand on food pantries and food kitchens. So I actually lived at the time of the pandemic in Washington Heights, and there was a food bank located very close to my apartment. So I had seen lines on weekends and things like that for the food pantry before, but I had never seen lines like I saw during the COVID-19 pandemic. The lines were super long. Sometimes they went for miles. It felt like they went for miles. I did not measure them. But there was a huge demand on food pantries and soup kitchens during the pandemic because many people were unemployed. In addition to that, there were about 22.9% of households in New York State that were experiencing food insecurity. And these rates were highest among women with children in the household, many of whom were single mothers. So as Dr. Chen was saying before, which is a really important point for understanding New York City, if you don't come from the region, in New York City, we're divided between 5 different boroughs. So we have the Manhattan borough, which is more high income, Brooklyn, which is kind of a mix of high income and low income, Staten Island, which also is kind of a mix, but it depends on what part of Staten Island you're in, Queens, which is pretty middle class, and then there's the Bronx, which is one of the lowest income boroughs in New York. So most of our participants that experience food insecurity were living in that region, and it tends to be mostly Black and Hispanic. So food insecurity during the pandemic. So if you look at the graph of food insecurity over time, the food insecurity in New York City was pretty stable. So there was a little bit of a bump over the first 6 months, so for the first wave of our study, but it tended to be higher than it was previously. So it had gone up previously, and it seemed to maintain throughout the pandemic that there was food insecurity. So if you look at the percentage of people who were newly food scarce during the pandemic, so in May of 2020 and of March and December of 2020, the number kept going up. So compared to previous times, so this is the first 6 months of the pandemic, the rates are going up to 30+% new people who are food scarce. So also the access of food during the pandemic at different points increased as well. So these are particularly important places for food access during the pandemic. Schools actually made a very concerted effort, especially in New York City, to still provide meals to students, even though they were not in person school. New York City students, many of them do not have a meal per day besides the food that is provided in school. So there was a concentrated effort to provide meals to these students. There were also food pantries, there were family, friends, neighbors, religious organizations. So there were many different individuals available for those experiencing food insecurity. And in addition to that, food insecurity was most deeply experienced by high poverty neighborhoods and Black individuals living within those high poverty neighborhoods. So it was a very issue that showed the disparities within New York City in terms of racial and ethnic disparities. So when I was thinking about food insecurity, I was thinking about it in terms of this model. And this model is not my model. It is from an article published by Letty in 2020. And it was looking at all the existing structural issues that existed within, particularly, I could apply them all to New York City. There's economic disparities, there's health disparities, there's a very fragile food system for a lot of these families. And then that impacted COVID-19, because in COVID-19, it exacerbated disparities that already existed. So there was an economic crisis, there were social distancing policies that created job and income loss, there was an increased demand for food aid, a stressed healthcare system. All of these contribute to the development of food insecurity, and then poor outcomes for individuals who were living in those conditions. And gender plays a role on all of these things, because gender is a disparity as well. There's this gender impacts both all of these things. So these existing structural qualities, COVID-19 related disparities, as well as food insecurity. It has a very strong relationship with food insecurity, gender, and it's most strongly experienced by women. In addition to that, mental health outcomes. So how does gender impact this model that was so nicely prepared by Letty 2020? Okay, so this is the population that we worked with. So we have the COVID check-in study that I described previously, which is from our existing samples. So there were about 503 female participants that I'm going to focus on for this talk. So for these female participants, if you look at, so for some reason my slides don't work on this format, but for these participants, many of them were actually high income, but we did have a group of female participants that were low income as well. Most of them did have children under the age of 18. Most of them came from our 9/11 samples. but we did have samples of women who came from our SNJ sample, so the criminally and justice exposed sample as well. And most of them were married as well. And the majority of them were white, but we did have different ethnic groups. So we had Black, Hispanic, Asian women as well. And in addition to that, most of them were about middle age, but we did have a distribution of different ages as well. So in our measures, we included COVID-19 exposure measures from the Household Pulse Survey, which was developed during the 2020 census. So the Household Pulse Survey was a big US Census test looking at how COVID-19 impacted these households. So it measured the impact of COVID-19 on US households. In addition to that, we used multiple measures. So we used the GAD-7, which is an anxiety screen, as well as the PHQ-8, which is screening for depressive symptoms. So both of these screens were used because these are the outcomes that we were interested in. So anxiety, depression, and how individuals would be impacted by COVID-19. So we did all of our interviews over the phone by interviewers. So 65 respondents, so 10.4% of the entire study sample, reported food insecurity during the COVID-19 pandemic. So, and among women from multiple racial or ethnic groups, 12.9 reported food insecurity. So these are just some covariates associated with food insecurity in female participants. So I think that there's something wrong with the PowerPoint, but in terms of the things that were significantly associated, unemployment was significantly associated with food insecurity in female participants, as well as coming from a low-income background. And of food insecure female participants, 24.6 reported depressive symptoms and 29.2% reported symptoms of generalized anxiety disorder. So these are low-income, unemployed females who are reporting depression, generalized anxiety, and food insecurity. And of the covariates that were associated with depression or anxiety in our COVID participants, the strongest associations were being low income, living with a partner. So this was kind of not a marriage relationship, but more of a common law spouse sort of relationship, and experiencing food insecurity. So these are the covariates associated with anxiety or depression in these COVID-19 participants. So these are some conclusions and recommendations. So these results support the association between food insecurity, depression, and anxiety in women participants. And I think New York City and New York State in general did a really good job in several areas supporting people from low-income households who could potentially be vulnerable to the impacts of COVID-19. However, there's still more that we can do. I think that the childcare support during school closures was not great. There was a lot of virtual schooling that fell mostly upon mothers that they had to do. And it was very difficult, I think, for a lot of families when people were attempting to work from home and also take care of their children and also school these children virtually online. So there needs to be better anticipation of that for the future and a better way to deal with that so that it doesn't fall on parents, particularly mothers. There also should be better unemployment and food assistance for individuals who are low income and we know will be vulnerable to similar pandemics in the future, because unemployment insurance or unemployment was impossible to apply for during the COVID-19 pandemic in New York City. The site kept crashing. There were hours and hours of waits. There needs to be a better system. In addition to that, there should be better food assistance. There should be more management of food banks so that it's easier for people to access, more information so that people know where to go, et cetera, et cetera. We can always improve upon what we've already done. In addition to that, there should be some sort of interventions pairing food banks and community health resources, because in addition to, because we know, for instance, that the people who are coming into these food banks are most likely experiencing some sort of mental health issue. It would be great if we can have someone on site from a community health basis who can work with those individuals, because it'll be a great place to refer these individuals. It would be also good to track these participants longitudinally over time. So is it a kind of situation where these food insecurity issues are only part of the pandemic, or do they precipitate over time? How long do they last, and how do they affect individuals who experience them? Okay, so I would just like to thank my co-authors for this paper, as well as the interviewers for this study. And this is an NIH-funded study, so I would like to thank them as well. Okay, so thank you so much for coming to my talk today. If there's any questions, I can take them now.
Great. I thank both of y'all very much. I think it's a nice pairing of these two presentations, because it not only shows a geographic spatial differences in needs over time as it related to the pandemic, but also you, Meg, your talk really focused on what those particular needs and how it still was, disproportionately allocated throughout the pandemic geographically. Dr. Chen, did you have your hand up for a question?
No, I just give applause for me.
Oh, okay.
but sorry, I need to leave to run
Okay.
for my next meeting. But any question, feel free to email me.
Oh,
Thank you for the
very much.
invitation. Really enjoy the session.
Yeah.
Thank you.
Thank you so much. Yeah. Thank you. Yeah. And I think from Dr. Chen's presentation, you could see also the racial disparities very clearly. So I think that that's something too, because the women who are mostly facing these food insecurity issues tend to be, especially in New York City, minority women. So I think that's something also really important that you can kind of use to tie our presentations together. But thank you, Dr.
It's a nice pairing. One thing that kind of struck me in thinking about before I open this up to the group for other questions is that there was a very much a difference in the variants. First wave was B, and then Omicron happened. You mentioned it, Meg, and it was very different. And so it was very clear in Dr. Chen's talk of how the people were more susceptible to a highly more transmissible variant, but it was less lethal during that time. But still, what your presentation showed is it didn't matter the variant. There was still the impact on food insecurity and mental health needs over that time. So that being said, I will open it up if anybody in our audience has I'm not there present to see who's raising their hand, but if you have a question to ask Meg. I don't see anyone there. I mean, I will say as a comparison in our college COVID study, also done at GPEG, is that the rates of food insecurity for that college undergraduates hovered around 34–35%. So it was even much more, of a serious need. And so interesting. We'll have to do some comparative analysis between the two.
Yes, definitely. Thank you so much for having me. And I'm going to break unless anybody has anything else.
Well, thank you very much, everyone. Thank you for attending and have a wonderful afternoon. Hope to see you at other sections.
Thank you.